Good morning, everyone. My name is Davide Corio. I am an exchange student from the Italian University of Milan Bicocca, and I am studying at the Russian International Academy for Tourism. I'm studying tourism management and I'm here to talk about my paper. My paper aims to analyze the socioeconomic and psychological effects that has been generated by COVID-19 on the tourism and hospitality sector, and on the willingness and propensity to travel of the tourists. In this article, I want to talk about the impact that the COVID-19 has generated on tourism, giving some data overview, talk about the psychological and social economic effects, and then concentrate on the impact on the airlines, and in particular how has the aviation industry dealt with the consequences of the pandemic. On March 11, 2020, the World Health Organization declared COVID-19 as a pandemic. Since then, the tourism and hospitality sector has seen a huge and dramatic decrease in the number of international arrivals. According to the UNWTO, the United Nations World Tourism Organization, in the first 8 months of 2020, international tourism registered a reduction of the 70%, with a respective loss of US dollar 730 billion in export revenues, more than 8 times the losses of 2009 due to the economic crisis. In this particular scenario, in which the international tourism has decreased, some countries like China and Russia are strengthening the recovery with the domestic demand of tourism that mainly characterize its general demand in the country, while in countries like Italy, where the inbound tourism covers a high percentage of all the tourist demand, the recovery is going to be very, very low. But in order to understand why there was such a decrease in the number of international arrivals, is necessary not only to focus on the numerous restrictions that were imposed by governments, but also it is fundamental to understand which are the psychological effects that have been generated by the pandemic on the tourist psyche. Uncertainty due to varying degrees of outbreak severity, quarantine, availability of hospital bed and medical appliances, and the huge media attention related to all the COVID-related information has generated dramatic effect on mental health, perception of safety, and behavior of the tourist. Many studies highlighted how concepts of ethnocentrism, xenophobia, and crowdedness perception are related with the perception of COVID-19 infectability. And nonetheless, were disclosed also the development of different forms of anxiety, depression, and post-traumatic stress disorder, mainly between the female population, the under 40, and all the suffering from diseases that make them more exposed to mortality linked to the virus. These data are crucial for any destination management organization and for any private company operating in the tourism industry, because they show how the pandemic has affected the mental health of a large slice of tourist population and how much this subject will be inclined to greater safety while traveling and staying overnight. Well, a crucial role will be played by the crisis management of each state, the respect of all the regulations approved by the WHO or other authorities, depends on the state, and the better management of the tourist carrying capacity in order to decrease the perception of crowdedness in the destination. As we can see in this specific slide, a research conducted by Bloom Consulting on a sample of 4,000 frequent travelers all over the world has shown that a percentage of them, varying between the 45% and the 15%, according to the capability of controlling or eradicating the virus, will not travel in the medium term for leisure purpose due to a sense of unsafety while traveling, that was found in the 64% of the cases, and only in the 15% of the cases were reasons related with an economic economic situation. And important is to consider that almost half of them will change the destination that was planned to go in 2020, with ones in which there is a good healthcare system, a low COVID-19 cases, and characterized by low crowdedness and with extensive hygiene attention. These results show how the tourist demand has changed and shifted from a general price-oriented choice to a more safety-oriented one. And a great example can be seen in the aviation industry. In fact, in the next slide, we are going to see how has the aviation industry dealt with the consequences of the pandemic. Since the first outbreak of COVID-19, aviation was the main industry in the tourism and hospitality one involved in the dramatic decrease of demand. Airlines had to become more agile and data-driven by deciding weekly whether or not to open new routes based on the limitation imposed by each government in each state in which they operate, changing their commercial orientation and convert their core business in order to cover the losses. In fact, many airlines, and United Airlines is an example of that, had to change their target, leaving a more business-oriented one to a more leisure-oriented one, adding new flight routes toward more leisure destination, due to the fast recovery that the leisure tourism has seen after the first wave, compared to the struggling business one. Another way in which the airline company has dealt with the decrease of demand was to invest in the cargo business by converting their normal flights, so the passenger flights, into cargo flights by modifying the structure to obtain some extra profit. An important decision was made by Qantas. Qantas Airlines not only had to deal with the decrease of demand of flights, but they also decided to leave its entire fleet of Airbus 380, which had previously served as a flagship aircraft, into a long-term storage, at least till 2023, which appears to be the soonest that the Qantas management believes passenger demand could return to the 2019 levels. Airlines not only had to deal with the decrease in the demand of flights due to the restrictions in mobility imposed by each government, but they had also to deal on how COVID-19 has changed the psyche of tourists. Alitalia, for example, was the first company to provide COVID-19 tested flights between Rome and Milan, giving two flights per day since the launch, in order to reach the needs of safety of its customers. In order to fly in such flight, in fact, passengers are required to show a medical certificate or of a negative molecular or antigen test carried out in the 72 hours before boarding, or undergo a free rapid antigen test at Rome Fiumicino Airport or Milan Linate Airport and receive a negative result. These, the one that I have shown here, are the main tools that have been adopted by airlines across the world to face both the drop in the demand and the new standards required by passengers. The pandemic had spread a sense of uncertainty and unsafety through the different slides of the population that will affect their behavior and their choices. So all the company, private or public, or the DMOs, the Destination Management Organization, have to understand the general trend of the demand that seems to be more interested on safety than on the money. Thanks to everyone for the attention.